Omicron continues to surge out of control with new cases skyrocketing across the nation and here in San Diego. Good evening and thanks for joining us. I'm Marcella Lee.
And I'm Richard Allen. Carlo has the night off. San Diego County health officials reported its highest daily case total. Nearly 7,800 cases were confirmed from yesterday. This is just one day after the county reported its highest single-day case total of more than 8,300. Hospitalizations surpassed 700, with 122 of those patients in the ICU. 11 new deaths brings that total to 4,487.
All of those cases are inundating our local hospitals as COVID spreads to the men and women working the front lines of the pandemic as well. As News 8's Abby Alford reports, this is causing staffing issues and making the problem even worse.
Here's the problem. You have people who are going into the ER with mild or asymptomatic wanting to get a COVID test, and then they're taking away beds in time. Then you have a staffing shortage that's going on. And exacerbating the problem, frustrated patients are taking it out on healthcare workers, some even being assaulted.
The Omicron variant is causing a near crisis in many ways at San Diego hospitals.
I would describe it as extremely serious.
Scripps Health CEO Chris Gorder says over the past 11 days, they've seen an increase of 130 COVID patients.
This morning, we had 5 medical surgical beds available in the entire healthcare system.
On top of that, Scripps says 15% of its workforce is out with COVID. Sharp Chula Vista is feeling it too.
And so we were already running lean even before this, and now with more staff having to not be able to come to work, that certainly makes things worse.
Aya Healthcare, a large traveling nursing agency, says typically there are 400 open positions in San Diego, but says they've been getting more requests from local hospitals.
A lot of additional staff or perm staff travelers are being asked to pick up the wait. Can you work an extra shift?
Scripps and UC San Diego Health say it's canceling non-urgent surgeries. Kaiser Permanente and Palomar Health are also facing long wait times in the ER. Many asymptomatic patients are showing up to get tested. Sharp Chula Vista Chief Medical Officer Dr. Samar Kador says this is also a concern for non-COVID patients.
And now we're seeing a lot of high acuity with also non-COVID coming in because their disease processes have progressed and they need to be seen.
And once patients get admitted, they're taking out their frustration on healthcare workers who are already exhausted.
And then they have people come in that are literally screaming and yelling at them, in some cases assaulting them. You know, and these are just healthcare heroes that are trying very, very hard to take care of the patients.
Legally, doctors cannot decline care, but they are pleading that you do not abuse the ER system. They encourage people, if you are eligible, to get vaccinated and boosted, wear a mask and be kind.